Assalamu alaikum, my dear students. I hope everyone is fine. As you all know, we don't have much introduction because the situation is not that good. That's why we are going to start these classes online. Today we are going to start a subject that is known as Nursing Foundation. This is a first year GNM subject. This subject, most of the topics are practicals. Here we are going to start theoretical portion. Today we are going to discuss introduction of nursing. We will discuss in that what is the definition of nursing, what is the meaning of nursing, and who has started the profession of nursing. We are going to discuss in this topic today. First we will see the nursing meanings, that means dictionary meanings of nursing. If we will see the dictionary meanings of nursing, nursing means to nourish, to support, and to keep in good and to avoid injury. That means to help the injured person, to give care to a person, and to support the needy person. That is the dictionary meaning. In other words, if we will see, that means to give curative care and treat to the sick. That means who is sick and who needs to care, that is known as we have to give a nursing care to that person. Now we will come to the definition. If we will see the definition of nursing according to Florence Nightingale, we will discuss after this definition. As you all know, this is the founder of she is the founder of modern nursing. If we will see the definition of nursing according to Florence Nightingale, that means nursing is to bring healthy and those who are suffering from disease. That means who are suffering from disease and who are healthy also. That means we have to bring them together and to care them to prevent health and to preserve health and to cure diseases also to that person. This is the Florence Nightingale definition according to Florence Nightingale. If we will see the literal meaning of the word nurse, that means we have to see the nurse word. If we will see N denotes nobility and knowledge. That means nurse should be knowledgeable and nobility. She should have a good training. She should have a knowledge regarding treatment, regarding medicines, regarding nursing procedures. U denotes to understanding. Nurse should have an understanding. She should understand person as a patient. Patient, she should understand a sick person. R denotes to responsibility. That means nurse should have a good responsibilities. If nurse is teaching and if nurse is giving care in clinics, hospitals, she should have a responsibilities. In wards, in ICUs, she should have a good responsibility to care, to give treatment to the patients. Now comes to S. S denotes to simplicity. Nurse should have a simplicity as well as sympathy also. Now comes to E. E denotes to efficiency. Nurse should have efficiency also. This is the literal meaning of the nurse. Now we are going to discuss Florence Nightingale. As I have given you a definition of according to Florence Nightingale. Who is Florence Nightingale? We are going to discuss. Florence Nightingale is called as founder of modern nursing. She is called as a founder of modern nursing because she established nursing as a profession with two missions. She has given nursing in two missions. That first is sick nursing, second one is health nursing. Sick nursing means who needs care. Immediate care means emergency nursing. Whenever sick person is there, then we have to give care to the sick person. Health nursing means we have to educate the people. We have to educate healthy persons also regarding prevention, promotion of diseases also. These are two missions of Florence Nightingale. Now we will discuss when she born. Miss Nightingale was born on 12th May 1820 in Florence, Italy. She was born in Italy in 12th May 1820. Then she entered nursing profession against the wish of parents because her parents was not allowing her to do nursing training. Then she entered the profession against her wish, her parents' wishes. Then she started nursing training at the age of 31 in Duconi's Institute of Kesarworth. She has done nursing training in this institute only. This is not a college, this is a hospital based institute. Then she got a training in this hospital based institute. And then she completed her training in 1853. 1853, Florence Nightingale completed her nursing training. Then in 1854, as the Crimean War began, then she started her service in military hospital. When there was a war, she began her service in military hospital, where she made reforms with love and compassion. She gave care to the wounded soldiers and succeeded reducing mortality rate of soldiers. With her nurses, she has given care to the military peoples who were wounded, who got injuries in that war. Then she succeeded. She succeeded mortality rate to reduce mortality rate at that times. And that times she was carrying oil lamps with her hands with her nurses only. That's why she became known as the lady with lamps. She is already known as the lady with lamps. This is all about the Florence Nightingale. Now if we will tell about the primary functions of the nurse, what is the primary functions of nurse? Primary functions, if we will tell, that means helping a client to carry out the treat plan initiated by the doctor. That means who is the patient is that doctor has given treatment, we have to help the patient regarding the care, we have to give medicines according to doctor's advice, and we have to check vitals according to doctors, and we have to help the patients regarding this treatment also. Other function of the nurse is providing physical care and emotional support. That means we have to give psychological emotional support to the patient as well as disabled patient who needs nursing care. We have to give planning and teaching to the client. We have to give nursing education. That means health education we have to give patient as well as his family and relations. To restore and to prevent diseases, we have to give health education regarding family, regarding the disease. We have to give family education. That means family planning, health education we have to give the family as well as patients. And we have to provide basic nursing care. That means in basic nursing care we have to check vital signs. We have to check vitals. In vital signs means we have to check temperature, we have to check pulse, we have to check respiration, we have to check blood pressure. In this this is called basic nursing care. We have to educate the patient regarding nutrition. We have to give the diet plan to the patient. We have to check these vital signs to help the doctor to diagnose the disease as well as to give a good nursing care. Good nursing care. So this is all about the introduction. So if anyone is having a doubt, she or he can text in groups. The next we will discuss.